So hold on just a minute. We'll see if we can get him back
Can
on the
you
line.
still hear me?
There, now we can hear you, Mark. Great.
Yeah, I'm here.
Okay, let's go.
Okay. Well, welcome everyone to this webinar. We're going to begin recording. This is for OPI, Oregon Project Independence, and this is Module 2. And we're going to be talking about OPI forms and fees today. And hopefully if you received one of the pre-webinar emails, you were able to download a copy of the PowerPoint. But if not, we'll send out an email later giving you the opportunity to have that PowerPoint that we're using today. And then I also encouraged the attendees to print out the forms that we'll be using and looking at today. So some of you may have those forms, and those will be very useful to you as we talk about them because you'll have them right in your hand. So we're just going to begin. And this Module 2 is really just an overview of the OPI forms and fees. And we're going to look at the approved forms and discuss how we use them and how we fill them out. So just a word concerning OPI forms. Why do we need to use specific forms? Well, first of all, it's a part of our OPI rules. And those rules state that the collection of required program and fiscal records and data associated with OPI must be on forms and data systems as approved by the department, which is the Department of Human Services. Now, in some of my slides today, I'm going to be making reference to the Oregon rules, and you will see rule references on the slides, and here's an example of that where I give you the reference. I'm not going to really read out or spell out the rule reference. It is in the PowerPoint. But the Department of Human Services wants us to use approved forms. Now, DHS and the O4AD, which is the Oregon Association of Area Agencies on Aging and Disabilities, along with AAA directors and the State Unit on Aging, came together and agreed that all the AAAs are going to use specific forms in order to collect consistent information across the state for the OPI program. So some of the forms that we'll be talking about today come from that list of forms, which was approved by everyone when they got together to discuss them. There is an action request transmittal that details those forms, and I've put that on the slide. You could see it there, APD AR 12039. And then additional forms for the OPI program are required because many of our AAAs, not all of them, but many of the AAAs use the statewide home care workers, and the home care worker union in collective bargaining made agreements with the state of Oregon. And some of the forms that we're going to be discussing today are required because of that collective bargaining agreement with the state of Oregon. Now, if you don't use home care workers and you use an agency, those forms won't be of concern to you, but we'll get to those later and we'll talk a little bit more about them. So I just wanted to begin with the list of forms that we're going to cover, and there's two slides. One is the OPI risk tool. Then we're going to look at the OPI fee determination, the OPI service agreement. We're going to look at a task list and actually look at how to pull it or do a task list and pull a task list. And then the home care worker forms like the 4105. On the next slide, we'll see some other home care worker forms, the workman's comp agreement, and then other things that everyone should use, such as the notice of privacy practices, an optional form that goes along with that privacy notice, and then the service plan, and then the authorization, which is that release of information document by DHS that we use to get information from our clients in order to help us with the OPI case. So I wanted to begin by maybe talking about the process very, very briefly of the home visit, because that home visit can help you get many of the forms that are required signed, and it can also be a time when you can gather information that is used in the required forms. So at the OPI home visit, you would be completing an OPI CAPS assessment. Now, if you're familiar with the CAPS assessment, it does give you the option of using a Title 19 assessment, but we would rather that you use an OPI assessment, because we found that when we use a Title 19 assessment and then put an OPI benefit onto a Title 19, we get an error in the statewide mainframe system, and the information doesn't carry over correctly. So it's important that you use the correct type of assessment when you're beginning to do a CAPS assessment. It should be an OPI assessment. And then also at that home visit, we want to complete a risk assessment. We're going to look at that document in just a moment, but that's the kind of document that you really need to be sitting down face-to-face with someone to get the answers to those questions. And then we're also going to want to gather income and medical deduction information at that home visit, because we're going to need that when we fill out the 287K form for OPI. We also want to discuss possible service options available in your area. You know which services are available. They're not the same in all AAA areas, so you will know what it is that you're offering to your client. And you may also want to give information about other programs, especially if you don't think that the person can benefit that much from OPI, but could possibly benefit more from another type of program. So now let me look at some of the forms that you'll want to take with you to that initial home visit. You'll want to take the OPI risk tool and the notice of privacy practices, which is the form that you'll just give to them. The 2092 acknowledgement, which we're going to talk about, that's optional. And then if you need more information, and especially if you need medical information, you're going to need the 2099 authorization or release of information. So I would always have those forms handy with me at the initial home visit, and that would get those forms out of the way, and it's the easiest way of actually accomplishing getting those forms in the hands of the individual. Now, where do we get these forms that we've been talking about and will talk about? Well, you should use the most recent OPI forms, and you can find them on the DHS forms server. Many of you are familiar with that. Or you can get them directly from the State Unit on Aging website. And we've given you link addresses to both of those locations so that you can find the forms. Something that you probably shouldn't do is just keep forms on file, paper forms that you've downloaded once, and then use those for years and years, because forms do change, and it's important to look at the date at the bottom of your form to make sure that it's the most up-to-date form that you're using. So let's begin with one of the first forms that we're going to look at in greater detail, and this is the OPI Risk Assessment Tool. So I just want to talk for a moment about why we're using the OPI Risk Assessment Tool. This tool is really used to prioritize OPI services for individuals that are at risk of being placed in any kind of community-based care facilities. One of the main goals of OPI is to keep people in their own homes and to provide them services there, so that they don't have to move out of their home into community-based care. So we want to look at the risk factors that are threatening to have a person actually move out of their home because of those needs and into community-based care. And it also helps us to prioritize the people who need the program the most. So sometimes in some of our AAA areas, we get to a point where we've run out of OPI funds and we're serving as many people as we possibly can, and we're starting to put people on a waiting list. If we're really going to keep to the ideals of the OPI program and meeting the people who have the greatest need, then we will use the OPI risk assessment tool to kind of tell us who are the people at the highest risks and maybe put those at the top of our list. You may have a different process and different priorities in your local office, and we just ask you to follow your local office procedures. This form is also used to gather statistical information for the O4AD to help us better understand our target populations and to communicate with the Oregon legislature when we're trying to communicate the need for funds for OPI statewide. So it has many uses. We're going to now look at that risk assessment tool, which is the Form 287J, and you may have a paper copy right in front of you in your hands. And what you'll see is at the top of the form is a place really to identify the individual and the risk screening date. Don't be concerned about the risk scores at this time. I'm going to explain that in just a moment. But you'll want to get the person's information there. And then next, following that, we have Section 1 of the risk assessment tool. Now, each question is self-explanatory as to scoring, and scores are marked on the right column. If you've correctly downloaded this form and you're using it online, then everything will self-calculate. If you've printed a copy of this and you're doing a paper copy and taking it with you, then you're going to have to be calculating this by hand as you're adding up the score. But for example, in Section 1, Question 1, it asks, do you need help to do the following? And it lists walking, dressing, getting out of bed, bathing, etc. And then we have instructions for that question. If you circle 2 or more, then score 2. And if you only circled 1, then score 0. So we can see in this example on the slide that I've circled a couple of things and the score is 2. So the same is for each of the questions. Each of the questions are very specific. You'll want to be right there with the client, asking them if they've had number 2, for example, if they had a fall in the last 6 months, and then it gives you a little bit of idea what kind of injuries we're looking for or asking about. Or number 3, do they have a family member or friend that can give them help when they need it? So once you finish Section 1, you should have a total score, and we're going to see this on this slide, which I've just put up. So the Section 1 score is the total of everything in that column and in that section. And as I said, some of you will need to calculate that by hand if you're not doing it online. So let's go to Section 2. And in Section 2, we only have 2 questions. And if you have a paper copy, you'll notice that these are on the second page of this 3-page assessment tool. And they ask the question here, do you or family have concerns about your mental or emotional well-being? Now, we know that this is a delicate question to ask people, and some people may not be able to answer you directly. You may have to get this information from collateral contacts from other family members, but ideally it should come from the person. And it gives us a little bit of an idea of what is meant by very concerned or somewhat concerned, but we'll want to get a score for that. And then another touchy question is about a person's finances, because we're asking about how the amount of liquid resources or assets a person has. And we'll just want to be general about that because we have a kind of scale here, and we don't have to be very specific. So normally people don't have a total of all of their resources in their mind, and we ask them to give us their best estimate of what their liquid resources are, and then find a score that correlates with that amount of money and place it on this section 2. So then we also have a score total for those 2 questions. You'll find that right below section 2 is a little key, and that key says that if the total of both sections' scores were 0, this person is not at risk. If the score is 1 to 5, they're low risk. If the score is 6 to 10, they're at moderate risk. And if it's 11 and up, they're at high risk. So now we go back to the top of the form, right next to the area where we put their name and other personal information, and you'll see a little risk assessment tally box or place. So we want to put down the score from section 1, section 2, the combined score, and then the risk level that came from that little bar that we just looked at. And so what we're really going to be concerned about when we report this to other people is the combined score and the risk level. If I was narrating in the case narration the result of the risk assessment, I might put something like risk assessment client is combined score of 7, and that makes them a moderate risk. So that's all we would need to say about that. Now, this isn't the end of the risk assessment tool because there's a little bit more to it. So if we look at the next section, we kind of have a survey area, and we want to list chronic health conditions. Now, there's a very specific list there for us, although at the bottom we do have a place for other chronic conditions. But this information is being gathered by the O4AD for statistical purposes. And so we want to maybe go down this list asking them if they have been diagnosed with this health condition, and if it's chronic, if they continue to suffer from it, and we'll just go down the list asking them about those specific diseases or conditions, and then asking them if there's something else that wasn't on the list. Right after that, we will find some other information that's gathered for statistical purposes. One question is, has the individual been hospitalized in the last 6 months, and if so, how often? And the next question is, have they been to the emergency room in the last 6 months, and how often? And then the last section of this form, which is entitled Reassessment or Final Disposition, and on my PowerPoint slide I have a red arrow pointing to that section. This section is used only when a person is leaving the OPI program. So if they're going off the program, we'll want to do a new risk assessment and fill out this final disposition. Or if the person has failed to go beyond the initial assessment application process, or if they have died, we'll want to fill out the disposition. That way we have a record of a person's risk and why they may have moved off the program or were not able to enter onto the OPI program. So this really is the end of the 287J risk assessment, and we're going to go next to one of the other forms. Of course, at any time during this webinar, you can type in your questions, and we have some time during the presentation where we'll look at those questions. So if you had a question about the risk assessment form, you can type that in for us. What we're going to be looking at next is the Notice of Privacy Practice. That is Form 2090. Now, Form 2090, Notice of Privacy Practice, you'll see that that form has the logo of the Oregon Health Authority at the top left. This is also a 5-page form. There is no place on this form for the individual to sign. We don't need this form returned to us. We just need to get this privacy practice information into the hands of our OPI individuals. Now, this notice is broken into 3 sections, and it really is very clearly laid out for them, and it has large graphics, so it should be easy for someone to read. But it tells about the person's rights. It talks about their choices when it comes to their privacy of their information, and how we might use their information that we're gathering for the OPI program. So you will want to read through the entire 5 pages on your own so you're familiar with them. You don't need to read this to a client unless maybe they were blind or had vision impaired problems and they were not able to have someone else read this Notice of Privacy Practice to them. Then you would want to give it to them verbally so they do receive the information in one form or another.
Mark?
Yes?
This is Christy. I just had a question come in.
Okay.
They said the question is, we have been using the risk assessment tool on the phone as an initial screening tool. Should we no longer be doing that?
No, I would say you should continue to do that because that's an excellent way of using it as a screening tool, especially if there is a waiting list or there's a shortage of OPI funds and you really need to find the neediest people to go out and visit and do assessments. So that is still an excellent tool to use for those purposes. Any other questions?
That's it. Thank you. And I'd like to just encourage people to go ahead and type in your questions, and we'll stop along the way and answer them. So thank you, Mark.
Okay, so now I've gone on to the next slide, which I've actually gone to the bottom of the first page. And I just want to point out that all of our forms have a date, and this particular form, you can see there, is dated February of 2014. So it's a relatively new form, and we may have had a previous Notice of Privacy Practice. So you'll want to be using the most current form, and the best way to do that is to go to the form server or the SUA website to be sure that you have the most up-to-date and current form. So I'm not going to be looking at the details of the 2090 today. I just want you to read it and become familiar with it so that if an individual has a question about it, they're able to ask you and you've actually at least read through the privacy practices so that you're familiar with it. And I think that that would help you and it would help them. So what I want to go to next is something that was created. It's actually the Acknowledgement of Receipt of Notice of Privacy Practice, which is a long title for a form, and it's the Form 2092. This form was created by DHS as a partner form for the 2090 that we just looked at, the privacy practices. The reason that this form was developed is that when we give a person the Notice of Privacy Practices, we really don't have a documented method of showing that they have received that form. So Form 2092 was created so that the client would sign this form after receiving the Notice of Privacy Practices as an acknowledgement that they did receive the information. Now, because this 2092 came out later than the 2090, it's not something that was agreed upon for the OPI program for AAAs when they got together to decide on the forms that we'd be using statewide. And so for that reason, this form is an optional form. And so I just want to make that very clear. I'll probably tell you 2 or 3 times that it's optional. But as we look at the next slide, you'll see that if you do use this form, right where they sign, it says, I, and then they sign their name, have been given a copy of the DHS or OHA Notice of Privacy Practices and have had a chance to ask questions about how my information will be used. So you notice there that when they're signing that they've had a chance to ask questions. That's why I say you should really become familiar with the Notice of Privacy Practices, and you should ask people if they have any questions about that. Not very many people will take the time to actually sit down and read this when you give it to them, but you can tell them that if they have questions later, they can contact you. But if you are using the 2092, we do need their signature. If you do not use the notice, acknowledgement of receipt of Notice of Privacy Practice, then what I'm recommending to you is that you clearly narrate in the case narration that you have given the individual the Form 2090 privacy practice, because that narration becomes your documentation that you've actually given this to them, since we're not using the 2092 signed form. So one way or another, either get the documentation back or give the notice and narrate very clearly that you gave it to the individual and when you gave it to them.
Mark, we have a question.
Okay.
What is recommended? Use the form, or is there no recommended practice from your viewpoint?
There's no recommended practice. It really depends on your AAA. Some AAAs lean heavily on having all forms in the file, and in that case, because we don't have the 2090 there, the 2092 is verification of that. But if it's well narrated, I believe that it has equal weight to it being having the secondary form in the file, because at least you've narrated that you've given it. So maybe you could talk about it amongst your managers at the AAA to determine whether or not you want to use the 2092. It also becomes, for some people, a workload issue. We don't want to overburden people with more forms than they actually need to be doing. But this is a great help. And I myself have found that if I'm doing a home visit and give them a Notice of Privacy Practice and simply have them sign the 2092, then I have everything I need, and I know that I've given it to them, and I have documentation. So it makes me feel better about that responsibility.
Great.
Okay, let's talk about another form. These 3 forms can get easily confused with one another because they have similar numbers. But I think you've seen the MSC 2099. This is the Authorization for Disclosure of Information, or it's also called by many people a release of information. And so this form is used when specific information is needed from a third party. If you happen to have your copy of the form, you'll notice that there are several areas that need initials and then signatures, and then we have date ranges and expiration dates. This form is very useful, but it's a little bit complicated. just to kind of boil it down, this release of information gives release for specific information, not all information. So for example, if you were getting a release from one record holder, you wouldn't want to say that you want all information pertaining to and then name your client. You have to be very specific about what information you want. So if you want medical information, you want to be specific that you want documentation of a medical diagnosis, or you want doctor's notes from the last 2 months. It just has to be specific. And then there are certain things on here that by law, a person has to specifically release information concerning those things, and that's why in the center of the form we have a place for initials for HIV, AIDS, mental health, and genetic testing. That information cannot be released just by the general signature of this form. It has to be specifically released by the initials next to those categories. So because this is a little bit complicated, there are some instructions that go along with this, and I'll talk about that in a moment. But first I want to maybe address when we might use this form for OPI. Well, a good example is for an individual who's under the age of 60. Because the OPI rules state that if a person is under the age of 60 and applying for OPI, they have to have a diagnosis of Alzheimer's or a related condition. And the rules have a place where they list many of the related conditions. One of those related conditions is MS, or multiple sclerosis. So let's say you have an individual who has MS, and they tell you that that's their disease. Well, what we need, according to the rules, is documentation from their physician about their diagnosis for MS. So we would use the 2099 to specifically pinpoint a specific doctor asking for a record that shows their diagnosis of MS, and that is going to be released to you, and then the client will sign the form. So that's a good example of when we might need medical information. Sometimes we might need to speak to a family member that is not an authorized representative, not a power of attorney, and not a guardian, but if they're very involved with the individual's life and case and OPI program, we might get a release of information so that we can freely talk with that individual, and the OPI client knows that we're talking with them and is full agreement with that communication. Let me go to the next slide, and we'll see that there is another form. It is the 2099I. Let me go there. There we are. The 2099I. And that is instructions for completing this authorization form. So the 2099I are 3 pages of instructions. You'll want to read through those so that you become familiar with them. And there's some very good information in those instructions. So for example, I'm just picking out a couple of things from the instructions. And one thing that we're told is that we can never ask an individual to sign a blank authorization or release of information. So we actually have to have it filled out before they can sign it. Another thing we see in the instructions is that the client or individual has the right to cancel or revoke this authorization. So even though they may have given you authorization for the period of a year to get information from a source, they could write you a note or give you a phone call and cancel or revoke the authorization and then we would have to make note of that in the case narration, and we could no longer use this signed document to get information because the client has revoked it. So as you can see, there's a lot that you can get from the instructions, and I would just encourage you to read through those instructions so that you know everything about this release of information form and how to use it. Okay. Are there any questions that have come up as a result of our discussion of that release of information?
I'm not seeing any at this time, but please feel free to go ahead and chat those in or type them in the question section, and we'll get them to Mark as they come up.
Okay. So let's go on. We want to talk now about some forms that aren't really those forms that you can carry with you to a home visit, because they require you to go back to your office and use the information that you've gathered to fill out the forms. So what we're going to look at here is one of our mandatory forms, which is the OPI Income Fee Determination form. That's the 287K. Now, as you probably realize, OPI has a lot of 287 forms. So it's the letter that makes the difference. So this 287K is the income and fee determination. And this form guides you through gathering income and also deduction amounts so that we can calculate a person's net monthly income. And the reason that we need the net income is because OPI rules specifically use net income to determine a person's fees using the OPI Fee Schedule. So we're going to take a look at the 287K income fee determination. If you look at the top of the form, if you have one in your hand, or you can just look at the slide here, you'll see that there's a place to put the name, prime number, date, and household size on this form. And I just want to say a word about household size. When we're talking about household, we're talking about household as defined by the Internal Revenue Service. So if a person was filling out a tax form and had to put number of people in the household, that is the same information that we would be using here. Sometimes there's some odd situations where a person has moved in temporarily to provide care. They would really never be counted by the IRS as a household member. So we want to specify that household number of household is according to the IRS guidelines.
Okay, Mark, a question did come in.
Okay.
Do we need a new form for each person, or can we list a couple of names on the same page? And that was
really, what we should do is, I'm going to try to interpret this question. If you have a household of two, let's say it's two spouses, but only one of them is on the OPI program, we're only going to need one form, and the person that's signed up on OPI is the person's name we're going to list. But when it comes to income, we're going to count the income of both people because they're both a part of the household and it's household income. If we have two people and they're both on the OPI program, then we're going to want to have two forms. That way we could have a specific case form for each person, because remember, this is a required form. So in that way, each person has their own required form, and we fulfill the requirement to have this form filled out for them. Okay. But when it comes to household income, again, we're going to use the combined income of both people.
Okay, Mark, she was referring to the ROI form. Does she need a new form? Yeah.
Which form again?
ROI.
I'm not familiar with that form. Maybe they can clarify.
Yeah, Bobby, can you clarify that? disclosure form.
Oh, the disclosure form. Yeah, the disclosure form has to be specific to the individual. So if there were two people in a household and we needed a release of information, we're going to need a release of information for each person. Sorry about that confusion, and I hope that answers your question. So getting back here to the income fee determination record, we want to list at the top of the form when it says gross monthly income, and we want to include all the income of the household. Now, you'll notice on my slide that I have a rule number, and that rule number specifies some of the things that we count as income. For example, all Social Security income, pensions, interest and dividend payments, annuities, railroad retirement, and other income. So those are the kinds of things that we're going to be putting on those lines and then totaling up the income until we have a total gross monthly income for the entire household. We won't generally verify income. That is, we're not going to ask for all the proof of all sources of income. But you'll want to follow your office procedures, because if your office does require documentation for all income sources, then you need to follow your office procedure, first of all. So that's up to the individual AAA on how they're going to verify. Some AAAs just take the client for their word about their income sources. Now, some income is easy for us to verify, such as Social Security, but others are not, such as dividend payments, so we might have to take a person's word on that. Okay, I'm going to take you to the next part of the form, and this is where we enter the individual's allowable medical deductions. Now, the deductions are specifically in the medical category, so our deductions don't apply to other areas of the person's life. Again, I have a rule number there for you, and if you read that rule, you'll find out that these are the things that we can include as allowable medical deductions, and this is just a sampling of them. We can allow Medicare premiums and other health insurance premiums, especially if somebody has a supplement, for example. Doctor visit fees or co-pays. Now, remember, we're trying to get a monthly amount, so we'll want to make an estimate of how much this is a month. So if they only see their doctor once a quarter and they have a copay, we'll need to split that up 4 ways to try to determine a monthly amount. Then there's over-the-counter medications, and we come across the same problem. Sometimes they'll say, well, I go to Costco and I buy the big bottle of ibuprofen, and I only have to do that once every 3 months, and it costs me $15. Well, then we'll estimate that that's going to cost $5 a month. And then there's medical or hospital bills, and those should be monthly payments that they're making, not a one-time lump sum payment this month, but there's nothing going to be paid on it next month or in coming months. Herbal remedies recommended by a licensed health professional, so that's very specific that if it's herbal, it has to be recommended by a professional. Healthcare equipment, which mostly is durable medical equipment. Medical supplies, which might be interpreted as things like disposable catheters, test strips, or other medical supplies. In-home nursing care, and non-custodial child support payments. So all those are allowable medical deductions. And you see one kind of stands out as not seeming to be medical. That is the non-custodial child support, but that's specifically written in the rule, and so that's allowed as a deduction. So the result would be the total medical deductions or allowed medical deductions for this individual. Okay, we want to go next to the net monthly income. So we take the total of all the income, subtract the deductions, and what we have, and you'll see on my slide there the red arrow pointing to the location where we put the net monthly income. Now, if you're using this Form 287K online, it will auto-calculate and auto-fill. Once you punch in the numbers, it will add everything for you. If you've printed a copy, you'll have to manually calculate these things and come up with the total. So once we have a total net monthly income, that is the dollar amount that we use when we go to the OPI fee schedule to determine whether a person has a one-time fee or a percentage fee that they'll be paying every month. And we'll look at that fee schedule in just a moment. But first, I would like to talk a little bit about some OPI rules concerning the fees. You have a rule number at the top of the slide, and it says that a one-time fee is applied to all individuals receiving OPI authorized services who have adjusted income levels at or below the poverty level. So the rules are very specific that if your income is at or below the poverty level, your fee is going to be a one-time fee. Now, currently, that one-time fee is $25. It used to be different in the past. So we want to be current as to what that one-time fee is with the OPI rules. It also says that all individuals whose annual gross income exceeds the minimum are charged based on a sliding fee schedule as established by the department. So it's DHS that establishes the sliding fee schedule. It's published, and it's usually published through a transmittal. And then once it's published through a transmittal, it's posted on the SUA website or on other DHS websites so that you can access them. So the rule that we just made note of makes it clear that OPI fees are a mandatory feature of the program and will always be addressed in the AAA area plan. And just another note, if an applicant to OPI refuses to provide income information, that means that we're unable to determine their net income, and because of that, we're unable to determine whether they're above or below the minimum as established by the Department of Human Services. So actually, if a person refuses to provide income information, they're not eligible for OPI because we cannot determine their eligibility. We really need income information in order to determine that eligibility. So you might have to have a conversation with someone explaining why you need the income information, and it's really used to determine what fees are paid, and there might be a situation if their income is low enough where they only have to pay a one-time fee.
Mark, we had a comment here.
Okay.
The 287K should state $25 one-time fee if net income is below the guideline, not zero.
Okay. That's right. That's right, because that's what the rule says. So, unfortunately, we AAAs do not make these forms, but we can make notes about them, and let's all make a note of that, see if we can pass that on. Thank you very much.
We have another question.
Okay.
Can we reassess fee determination at any time if one's medical expenses increase?
Yes, you could. You could revisit the fees if a situation changes drastically. I wouldn't do it if it's a minor change because it's a lot of paperwork. But if it's something that's going to be ongoing and if it's a substantial assistance or help to the client to have that medical deduction, then I would do another fee determination and narrate that we have re-looked at the fees, and based on a change in the person's medical expenses, this is their new fee from this point forward. I hope that answers your question.
Thank you.
Now, we do update a person's fees every year at the annual review. So every time we go out every year, we want to ask again if there have been any changes to their income or any changes to their medical expenses which become deductions. So we do review it annually and try to keep up to date, at least annually, on those figures so that we can be accurate as to the amount of fees that a person should be paying or not paying. Okay, let's look a little bit at an issue. I have two rules here on the slide. Now, information on how fees for OPI services are billed or invoiced, collected, and utilized is contained in each AAA area plan. Now, I have read about a dozen of the area plans, and I'll tell you that the invoicing and billing process is different for almost every AAA. Some are very specific to the person who will do the billing or invoicing, how it's collected, and what happens to the fees once they are collected. So be sure that you're aware of your area plan concerning the collection of the fees. And then the area plan also contains a policy for addressing individual non-payment of fees, including when exceptions are made for repayment and when or if fees can be waived in hardship cases. So again, I've read many of the AAA area plans. Some AAAs, if an individual has ceased to make payment of their fees and are given maybe a letter asking them to keep their fees up to date and nothing happens, they will close the case. Others might investigate whether it's a hardship that has occurred, and based on the information given, a certain person or people will determine if the hardship could cause a reduction in the amount that they need to pay. So all of that is very specific to the area plan. Some AAAs do make room for hardship cases and a process for that. Others do not. And just simply state that these are the OPI fees, and a person can be on the program if they pay the fees, and if they can't pay the fees, then they can't be on the program. So it's really very individual for each AAA.
Mark, is that $25 fee once in a client's lifetime?
Yes, it's
Okay.
a lifetime fee.
Thank you.
So once they pay the fee, even though we're doing an annual assessment, they don't have to pay it again. They've paid it one time. So there should be somewhere in your record that you made note that the client was invoiced for the $25 fee. That fee has been paid, and they no longer have any other fees associated with the program. So narration is a good place to keep that. And if you do an annual determination of fees, and again, they qualify for the $25 fee, but have already paid it, we don't need to bill them for it. Okay, let's move on and actually look at the OPI fee schedule. Now, again, I mentioned that the OPI fee schedule can be found on the SUA website. And it also goes out by transmittal if you happen to have a copy of that transmittal for the last update of the OPI fee schedule. But if you're looking at the slide that I have up, you'll see that for a household of one person, any net income up to $1,459 will pay 0% on the current schedule. Now that's going to be 0%, but they will have to pay the $25 annual fee if they haven't already paid it. So you can see there at the red arrow that I pointed out, it says 0%, so they're not paying a percentage, which means that they're subject to the annual fee. If I change slides and now look at a different income, you'll see that incomes above $1,460 will have an OPI percentage fee according to the current schedule. So, for example, a person with a net income of $1,800 will pay 10% OPI fee. So those of you who use home care workers know that the current home care worker rate is $13 an hour, and this means that the person will be paying $1.30 an hour for the approved number of OPI in-home hours. So that percentage translates into the amount that they will pay monthly, but we can also break that down by the number of hours they use to know the hourly amount. And sometimes that's useful in helping the client to understand the benefit of using the OPI program and the cost that they'll incur by having in-home assistance. Okay, I want to go to the bottom of that income fee determination. And we can see here that if their OPI percentage to pay was 0, then it says if adjusted income percentage is 0, a $25 one-time fee is charged. And there's a box to say yes or no. So that might be a place where if a person is paying the one-time fee for the first time, you will mark the box yes. Or you might be able, at an annual review, just to make a little notation somewhere in that area that this has already been paid, so that when someone looks over this form and looks at the income and deductions, they can see that the one-time fee has already been paid. So that's information that can be carried over from form to form. Okay.
So Mark, we're coming up on 2:30, so I don't know how much more we have to present.
We have a ways to go.
Okay.
Do we need to take a break?
Well, I think we could keep going.
We'll try to keep going, maybe at a faster pace.
Okay, great. Thank you.
Okay.
Oh, and there's a one-time or annual was the question here, and I don't know what it was referring to.
Yeah, well, they're not the same. The question is, do they have a monthly percentage that they pay or a one-time? It's not an annual fee, no. The $25 is a one-time fee. It is not annual. They don't have to pay it every year. They just have to pay it one time. Okay, so I think that what I have on the next slide is simply an example of how to fill out the form once you've determined the number of hours of help a person is receiving, the actual cost of those hours and the percentage that they pay, so that you come to a total and are able to discuss with the client what they need to pay on a monthly basis. Let's go on to the next slide, and we'll see that the AAA determines what services are available in your area. So not all services are available in all areas, but you'll want to put down the cost of those services and the percentage that the client or individual needs to pay. Then, lastly on that form, we'll need signatures. And you'll want to narrate the fee determination, including the amount of net income and deductions. And you'll want to narrate what the monthly fee is going to be, or if they just need to pay the $25 one-time fee. Be sure that that is in narration. Okay, so we're picking up the pace a little bit. And one thing I did want to throw in here is when we're using access, the same information that we've gathered on this form needs to be in the Access Service tab. Now, on this slide that I'm showing you, I've taken a little snip of that part of the screen from Access. So when you click on the Service tab, you will there give the case action of approved, the approved date for OPI. You'll want to put in some notes. This is not something we're going to print out as a rule, so you don't need to be specific what you put in the little admin rule and reason box. We just want to explain that the person is eligible for OPI. But there next to the blue lettering, we do want to put the person's monthly fee as determined by the form and the percentage that they're going to be paying for the OPI program. So that is in Access at the Access Service tab. Now, in an upcoming training, we're going to be looking at some of these access things, so we might visit this again in another training. Okay, so next I come to the OPI Service Agreement. The service agreement is really a very simple form once you've filled out the fee determination, because you would put down the individual's name, date, number of people, their household income as adjusted on the previous form that we looked at. Then you will want to note the number of people in their household and the adjusted net income. And then finally, at the latter or bottom half, this notice helps the person understand what they're agreeing to. So they're either agreeing to a one-time fee of $25 that's going to be billed once, not annually, but just one time, or a monthly fee based on their actual use of OPI services.
And Mark,
and then there's a place to list those services and the total cost.
Question.
Yes?
Yeah. Is that left blank when they pay the one-time fee?
Actually, it's not left blank. The screen that you're seeing right now, it shows percentage, but you wouldn't leave it blank. You would just put 0%, and the hourly rate would be 0, and the total would be 0. So I think you should still state what services they are receiving, even if the cost is 0. Now, the example that I'm giving you on this slide, there is a cost. Usually we don't have a mix of home care worker or agency, but in this case I put both just to show you how it might look to use either one. And then I also discussed putting down other services like home delivered meals if that's offered in your area, and whatever cost might be associated with that. So I think my slides are self-explanatory in that way, but I wanted to give you an example. Okay, so let's go beyond these next few slides and beyond the questions. What we're going to do next is look at some forms that are used for home care workers. Now, those of you who use agency exclusively will not be using the home care worker forms. And for that reason, I'm going to be going through them relatively quickly. So the 4105 is a home care worker notice of authorized hours. Whenever we change hours or we award hours to a client and they hire a home care worker, we need a 4105. And the notice should provide the date of action or when it becomes effective. So the OPI desk manual does imply that we can use the local equivalent of the 4105, but in actuality, because of union negotiations with the state, there's no such thing as a local equivalent. We have to use the official form 4105 as a notice to the home care workers. Now, this is what the 4105 looks like. I think it's self-explanatory in letting you know where to put information. There's several lines which I've discussed on the slides. I'm going to go through them just by clicking from one to the next, but you can read the PowerPoint if you've downloaded it to know what each line is used for and what kind of information we might be placing on those lines. And then in the second half of the form is a reason for the action, but what I wanted to point out really was the Article 17.2 of the Union Bargaining Agreement. And so this form specifically states that the bargaining agreement requires written notice to the home care worker, and this form, 4105, serves as that written notice. So this is the way that we will fulfill the bargaining agreement. Okay, so let's remember that home care workers do not have a right to a hearing based on changes to hours or services. So if a home care worker calls and wants some kind of a hearing because their hours have been changed, there's no such thing as a hearing for a home care worker. Okay, let me look at the task list. This is something that is used both for agency and home care workers. On the slides, I show you how to get to the task list. If you were in the service plan for CAPS access, you would look under Provider Detail, then go to 546 Details button, and then the task list. And then there in number 1, shown by the arrow, we would select the tasks that we want the home care worker or agency to do. You can use the scroll button to access the entire list. And then there's a little checkbox, that's arrow number 3. That has to be checked before you can go forward and actually print a task list. So after you finish that and given any remarks, you can click OK. And then you go to the Access Printer logo or icon on the case. You would type in the form number 598N, and then under CAPS 2 task list, you would click Print or Preview, and that would take you to a task list that looks like this. This is a printed form that comes directly from the printer in the case, and this particular example is a fictional training example, so no information is real, but it will list the client and the provider, and that might be an agency. It will list the amount of money or the rate that they're being paid, and it will talk about the tasks that are authorized for that provider. If you go to the form server for a task list, it's going to look a little bit different. The form server task list looks like this slide, and you would have to fill in all information. It doesn't autofill, and that's why I like to use the one from the Access case, because it's already filled in with the person's personal information. But you can get a task list from the form server.
Okay, we have a question here.
Okay.
We contract out our OPI services, and our contractor providers are using their own task list, which is similar but not exactly like the 0598. Can they use their own form?
Well, a question I would have is, where did they get the information for the task list? It should come from the OPI worker who has done the assessment and somehow communicates to them what tasks are needed or required or authorized to the individual. If the communication came from the OPI worker, they probably could use their own task list, but in actuality, this task list from Access is something that would be required if they used a state home care worker that has an Oregon provider number. And one of the reasons is if there is an injury and there is a workman's comp claim, the very first thing workers' comp is going to do is going to call the OPI worker and ask for a copy of the official task list. Because if they were injured doing something that's not on the task list, they are not covered by workman's compensation. So for that reason, I would recommend a task list that actually comes from Access, that is developed by the case manager or OPI worker, and that clarifies what the authorized task was for workman's comp purposes. So I hope that answers your question, but that also brings us to the next form, which is Form 354, the Workers' Comp Agreement. And this form is for home care workers, workers' comp insurance, but it lets the client or the individual know that the state home care commission is managing or taking care of the workers' comp for these workers, and the client agrees to cooperate with the process of workman's comp. And I think here's the top of the form, and the client will want to read through it to see the agreement that they're making concerning workman's comp, and then sign the back of the form. So I'll let you read that form for yourself, especially if you have home care workers that you use and you've downloaded a copy of the form. Let's go to the service plan. Now this is important for everyone, regardless of using an agency or a home care worker. The 546N is the service plan, and it's found in Access. And if you enter 546N in the printer section, it should autofill all fields. So here is an example of a 546N. It tells us the client's name, who the provider is. In this case, it is an agency. The bottom of the form will tell us how much they are paid. So in this example, 15 hours of daily living assist, which we consider to be ADLs, or personal care, is paid at $19 an hour, and it gives the approximate amount of money that they'll be paid. This is an authorization for payment to the agency or the home care worker. And so the OPI worker will need to sign this form and date it as an authorization. Now, I do tell you in the slides where to get or where to fill in the rates. And I think I'll leave it up to you to maybe read the slides yourself and determine how to fill those in. I think I've explained it very well on the PowerPoint. If you have a question about this or are confused, please email us. We'll give you that opportunity in a moment to know where to email, and then we'll try to get back to you if you need more specifics concerning how to determine the rates or how to plug in specific rate amounts.
Mark, we have a question.
Okay.
This is my first time seeing the workman's comp agreement and consent. Should I go back and have all my clients sign it?
If they're using a home care worker, yes, you should have them sign it. If they're using an agency, there's no need to do that because the agency has its own workman's comp insurance. But by signing this, we have then the required form for home care workers, and this is required by the union agreement with the state of Oregon for all home care workers, regardless of the program we're using, including OPI. So if they're using a person with a state provider number, they do need to have the 354 workers' comp agreement signed. And it's as easy as putting it in the mail, having them sign a copy and returning to you and keeping a copy for themselves. Okay, I think we're getting very close to the end. thank you for hanging in there with us. So we have just a few more slides, and one is an OPI application. Is there such a thing? Well, there is no universal OPI application form, and AAAs respond to inquiries according to their area plan and screen the individual for other programs, including Medicaid. So there is not an application form for OPI. And a person's inquiry is taken care of in different ways according to the office procedure of the particular AAA. Another thing, is there an OPI denial notice? No universal OPI denial, reduction, or termination notice exists. So there's no required form for denial, reduction, or termination. But what AAAs should be doing is sending a letter or their own form describing the process in their area plan where clients can receive a notice of denial, reduction, or termination, and includes the grievance procedure. So that grievance procedure is very important to get out into their hands so they know that if there's a disagreement with the action taken, they know what to do. And that grievance procedure should include the individual's right to an administrative review by the State Unit on Aging per the rule that I've cited on this slide.
Mark, we have
Yes.
a question. Is UCR required when you close an OPI client?
And say that again.
Is UCR required when you close an OPI client?
Yes, I need the definition of UCR.
Okay, Maggie, could you type that in further? And the next question is regarding will this be available on the website? This presentation is being recorded, and we will get it up on the SUA website ASAP.
Okay.
Okay.
And it should have the PowerPoint with it so that you'll be able to download that or view it.
Absolutely.
So let me continue with the grievance procedure. All AAAs are required to have a written grievance procedure by policy, and you'll need to consult your area plan for that grievance procedure, but it should contain, one, an opportunity to communicate with management staff, two, specific time frames for a grievance, three, a written outcome at the end of the grievance process that gets back into the hands of the individual, and then also the option of administrative review with DHS State Unit on Aging.
Okay.
That's from the desk manual, page 51.
Okay, I have a follow-up here on the UCR. It says, this is from Christine Wilson, and she says the UCR is unique to Multnomah County, and the case manager should contact her directly. Christine Wilson, if they have any questions. And also, they were asking, Liz asked for the web address for all the OPI, for the OPI form server. Is it on the SUA website address?
Yes. Yeah. Well, I gave a slide at the beginning that had the web address for both, the State Unit on Aging website and also the form server at DHS.
So it's on your PowerPoint.
I think you just refer back to the beginning of the PowerPoint presentation and you'll have the website for both.
Terrific. Thank you very much.
Okay, any other questions? What I realized is that I forgot at the beginning to introduce myself, so I'll do that at the end now that we're closing. So my name is Mark Acuna, and I have worked for a few years as a case manager, including with OPI. I work for Northwest Senior and Disability Services, which is a AAA, and I do quality assurance and training at this point in time. So thank you all for participating in this webinar. If you have follow-up questions to the information that we have discussed today, the last slide has the email address for Sue Ann Jackson at the State Unit on Aging, and you can contact her with questions and we'll try to get the answers to those questions back to you.
Terrific.
If you need any other information, you can also contact Sue Ann, and I'm sure she can guide you in the right direction. So thank you very much for participating today.
And Mark, we have one final question. Where can we find the most up-to-date sliding fee schedule?
Okay, you can find that on the SUA website.
Perfect. Thank you. And on behalf of the State Unit on Aging, I want to thank all of you for attending today. I'm sorry we went over, and I apologize for the technical difficulties in the beginning. This has been a great presentation, Mark. Thank you so much. And as he said, please feel free to contact Sue Ann or the State Unit on Aging, and we'll get, if you have questions, and we'll get you the information you need. Thank you again. Have a great day.